Hi, everybody, and welcome to Basic Black. You know, some of you are joining us on our broadcast, and others are joining us on our digital platforms. I'm Crystal Haynes, your host. Tonight, breast cancer among Black and brown women. Black women are twice as likely to die from breast cancer and to be diagnosed with more aggressive forms of the disease. October is Breast Cancer Awareness Month, and we are speaking with survivors and experts so that our audience can learn more about the warning signs, the treatment options, and get checked out. We do have a great panel with us this evening. Joining me tonight is Dr. Naomi Ko, Associate Professor at the Chobanian and Avedisian School of Medicine and Medical Oncologist at Boston Medical Center. Nekia Clark is the Director of Patient Services and Outreach at the Ellie Fund and co-chair of the Boston Breast Equity Coalition. Nekia is also a breast cancer survivor. Jani Raynor is a patient living with breast cancer and a former patient at the Ellie Fund. And Karen Burns-White is the Deputy Associate Director for the Initiative to Eliminate Cancer Disparities Center for Cancer Equity and Engagement at Dana-Farber Harvard Cancer Center. Welcome to you all.
Thank you.
Dr. Ko, I'd love to start with you in that you just published some research about the disparities among women of color and breast cancer rates. So I wonder if you could talk to us a little bit about that.
Yeah. The recent publication we had took a look at the voices of Black women who had been treated for breast cancer, and we really wanted to dive into their perspectives and what makes survivorship different for them, and it was really a beautiful opportunity to get their voices and report on what's different about their experiences. And some of the things that we found were unique fear of recurrences, use of spirituality, some of the challenges with financial toxicities that they were faced, and stigma as well. So it was really a great project.
Yeah. Jani, you know, you have a very personal story with this, and when talking about some of those things, the fear, the financial hardship and things like that, I mean, I'm sure you felt all of those things. Talk to me a little bit about your cancer journey.
I was diagnosed with stage 3C breast cancer in February of 2022. I decided to act aggressively and get right into treatment as quickly as I could, so I started my chemo infusions in March of 2022. After my infusions ended, I did my single mastectomy in August of 2022, and then I went on to do proton radiation therapy in September of 2002, which ended all of my active therapy in November of 2002. I'm now on non-active. I'm still on chemotherapy, which is in form of pills, and I have estrogen therapy that I am on for 10 years. And I also do Zometa infusions, which are like a bone infusion to help with the integrity of your bones. It has been a life-altering journey. I'm still on, but the first part of it was eye-opening, and it also, like many other women have expressed, helped me get deeper into my spirituality and gain greater control of my mental capacity, because I knew that's what I needed to do to survive.
And the stakes are very high for you, and I am also thoughtful of when you learned about your diagnosis.
Oh, I have 3 children. I have a 12-year-old, an 8-year-old, and a 4-year-old. At the time, my 4-year-old was only 3, and I speak on that only because, as we know, 3-year-olds are so little.
Yeah.
They're very much babies at that age. It was devastating. I had just asked my soon-to-be ex-husband for a separation the month before I got diagnosed.
Wow.
And it was just turning my life upside down. That's how I felt. I'm an entrepreneur. I worried about making money. I worried about sustaining myself, my children. There was the vain part of me that was scared. What was cancer going to make me look like? What was going to happen to me physically? And then I was afraid to die.
Yeah.
I was afraid of my mortality and what this meant for my life. And I struggled for a very long time with all of those mental challenges that I had during my initial diagnosis.
Yeah. And Nekia, I know you're also a survivor of breast cancer, and you work on the advocacy side of a lot of this as well with the Ellie Fund and in the coalition. I mean, there are so many factors to think about when Black women are diagnosed with breast cancer and even getting a good diagnosis.
Yes, excuse me. There's fear. Your fear of doctors based on past experience with family members. So a lot of patients don't even get mammograms because they don't want to, or because other family members may say you don't need it. So you have to get over that fear. In education, a lot of Black women aren't educated on what to look for, how to find lumps, when you're supposed to get your mammograms, and the history of cancer. So those two factors plays a role in why a lot of Black women choose not to either get treatment or even go get exams.
Is access to that education readily available?
Not as it should. Most people, as you said, you have to advocate for it. I had to advocate for it, just knowledge. I had a little bit more experience because at the time when I was diagnosed, my mother was going through metastatic breast cancer. So I pretty much learned from her experiences and the things that she was going through to be able to advocate for myself as well as the patients that we serve.
Yeah, and Karen, I know you were nodding at some of these when we were talking about access to information, especially in Black and brown communities where we know this cancer rate is so high.
Absolutely. So one of the areas that I have the opportunity to work on is really looking at factors that can reduce the unequal burden of cancer. And we find, as Nekia indicated, that having and empowering individuals with knowledge is a big one. And so one of the things that is really important is to be able to take the information to where the people are at, to be able to raise awareness by way of screening, early detection, the importance thereof, the various treatment options, not to wait to seek treatment, but to get treatment, and really emphasizing to women, especially, that you know your body best. You know how your body performs. You know how and should know how your breasts feel, and therefore you need to, in fact, make decisions based on the knowledge that you have. And so it's really important, and as Dr. Ko indicated, taking information that they learn as a result of research, right, and disseminating that information into the community so that they have ways and reasons to make the decisions around their health care.
Well, speaking of getting information, we know that a recent national survey found that 22% of women in the U.S. ages 35 to 44 have never even gotten a mammogram and have no plans to get one. So I decided that on my 40th birthday, the risk was just too high for myself not to schedule a screening, and I wanted to share that experience with our audience here to show you that a little bit of discomfort, maybe a little bit more than a little bit, is certainly worth the peace of mind. Happy birthday to you. Turning 40 is a big milestone, a time for reflection on career, maybe expanding the family. Not when should I schedule a mammogram? And when I had one, I didn't expect to have to be called back in. Black women are about 40% more likely to die of breast cancer than white women, according to the American Cancer Society, and die at a younger age. Walking into the Thea Stoneman Breast Imaging and Diagnostic Center at Brigham and Women's Faulkner Hospital, I was nervous but determined to get answers.
Okay. Alrighty. And I'm going to take you to get changed, okay? So I'm going to have you change from the waist up.
After a quick check-in and change, my mammography technologist, Kimberly, guided me through the imaging process and to the room.
Can I check your bracelet?
Yes. And asked several screening questions.
What was your age of your first pregnancy?
39. Kimberly tells me her mother died of breast cancer, which is why she works here. She's guided hundreds of women through the process.
Perfect, just like that.
I was squeezed.
Now hold your breath. Don't breathe.
And repositioned.
This is going to be tight. How you doing? You still with me?
Yes. Radiologist Dr. Sona Chickermani went over my results.
There was an area on the mammogram that we just needed a few additional pictures just to confirm that it's benign or okay. We're looking to identify any breast cancers. So breast cancer can look like a density on a mammogram, but there are a lot of other things that can look like that.
Keep that on there.
Extra pressure, roughly 18 to 20 pounds, was put on my breast for this second screening. It helped get a better image of my breast.
Don't breathe.
My scans were clear, and now I can really
Breathe. Very good.
All right. Well, you know, getting a mammogram is just so important. And Dr. Ko, I wonder if you could talk to me about the differences in terms of the actual machine that takes the images of your breasts, because I know that, you know, I had a very thorough sort of 3D image taken, but that was because it was a diagnostic screening after an initial screening that I had.
Yeah. So actually the technologies are just honestly getting better and better. And so I want to say that, you know, the journey of improving science and improving these technologies is going on right now. And there are many different modalities. There's AI coming into play. There's the MRI. Then there's contrast enhanced mammography. There's just so many different iterations. So there's a lot there. And I think what's really important for women to know is that we start usually with a screening mammogram. So it's really the most simplistic pictures to take a look to screen. And if there's anything that comes up that looks a little suspicious or something that they just want to check out further, like as you would experienced yourself, then we just take it to the next level. And that next level mammogram is one that takes more angles. It has more of a squeeze or a different way of looking at the depth of the tissue to make sure that we're not missing anything. So there are a lot of different types of mammograms and mammography or imaging that it's really good to talk to someone about that. And so when you're interested in, you know, getting an evaluation, just being informed and ask questions. And, you know, people want to help. So that's, I think, really important.
Yeah, and in most women, from what I learned from Dr. Chikramani there, is that most women will go in for their initial screening, especially if it's your first, and most women, even if they have to come back, it may not necessarily be bad news.
Absolutely. And I think having that, being able to anticipate what that first step could look like, what the road ahead is like, is also critically important, because you need to know that, you know, try not to be too scared and try to like lean in and be okay and trust your providers. And I think for me, one of the things I really work on talking a lot about is how do we improve that trust? How do we help women, especially Black and brown women, feel like we are here for you? We so want to help you, and we so see you and want to hear you and be there with you. And I think that's really an important message.
And Karen, I know a lot of your research centers around that, like Black and brown women, Black and brown folks feeling safe in that healthcare space.
Absolutely, and I can't hark enough upon the importance of trust, the importance of developing a relationship. And oftentimes, you know, we want to engage community because it's the right thing to do, not necessarily because they have an issue, but because we want to develop a relationship so that they see us as partners and that they can come to us no matter what. And so a lot of my work takes me into community. Not always is it cancer-facing, cancer prevention focus, but it's really about developing that relationship so that when something comes up, when there's a loved one, it's, Miss Karen, I need this. Miss Karen, can you help me get a referral? Miss Karen, I called Dana-Farber, but unfortunately, they told me I have to wait a month. And so really it is establishing those partnerships so that if a need should come up, it's providing information and education for when something should in fact present, that they feel safe and they feel confident that they will be heard and listened to and acted upon.
Yeah. Jani, you know, I want to share with you that Kimberly, the technician there, her mother had passed away from breast cancer, and she actually changed her concentration, and so that she could be in the space in these rooms so that women of color saw someone that looked like them and felt comfortable, because she didn't have that experience when she was helping her mother through that process. How important is it to see people that look like you in what can be a really scary space?
It's essential. For me, and let me just digress, if you don't mind, 1 minute. We were talking about mammograms. What I didn't share initially is that I found my own lump. I had never had a mammogram. And I was turning 44, and I never had a mammogram. So my mother's mother, my grandmother, passed away of breast cancer, as well as my mother's sister, my great aunt. I knew it was a history in my family, so I kind of was cognizant of doing my own breast exams. But like many black women, I didn't feel the urge to get a mammogram because I hadn't had great interactions with the health industry, even with my pregnancies. I decided to go get my mammogram after my mother urging me, because I found the lump, and it was pretty significant. I had lost a lot of my pregnancy weight, so I kind of gave myself all of these reasons why I may have a mass of that size. Initially, when I got the mammogram, they knew right away. Like you, I was called right back in. I had to get a biopsy. When they told me I had to get the biopsy, I kind of figured what was going on. I have to say that when I came into my mammogram, I was met with women of color. That immediately put me at ease. And it's not that if I had a white doctor or a doctor not of color that I would immediately tighten up, but there is something reassuring about someone who looks like you or even talks like you, who can say, it's okay, you know, this happens. We've had many other women, black women historically have dense breasts. So they gave me a lot of reasons why I could have this mass. Unfortunately for me, it was cancer. But I have to express, especially to younger black women, I know to some young girls it's going to say, oh, you're 45-year-old. I'm not that old. But what I'm finding is a lot of women, even younger than me, are getting diagnosed, specifically black women. And I have to impress upon anybody watching self-examination too. If you are a little scared or you're apprehensive about going into a medical situation or environment, I understand that. But take some initiative. Check yourself in the morning, at night. My daughter's 12, and I already have her learning and understanding what it means to check your breasts.
That's huge.
Even with my son, the rise of breast cancer in black men has been rising as well. So I'm sorry that I digressed a little bit, but I just wanted to say that I found my lump. And I hadn't had a mammogram. So I have to impress upon young, especially young black women, check yourselves out. If you're not at the age to get a mammogram or you're not quite ready to step into that, make sure you're checking yourself morning and night.
Nekia, I know, I can feel you nodding, you know, about all of that. Yeah, talk to me.
Yeah, so she is so right when she says that. Back in middle school, I remember in the nurse, she would come into the classes and talk about health and how to do self-exam. So I've always done it since middle school. And in 2009, I did find a lump. And I had to go to the doctor a few times, but they said everything was fine. But what it did was prompt my mom to go get her first mammogram. She was turning 50, and that's when she was diagnosed with breast cancer. So I feel as if I didn't do that or go through that experience, it may not have prompted her to go and get her mammogram. And then when a few years later, I also felt a lump. I felt something wasn't right. In that same area where they actually removed and it was benign, I felt a lump. So I still continue to self-examine. It's so important because I had a mammogram 6 months prior to me finding my own breast cancer. So it is very important to self-exam. I can't stress it enough. And it would be like working at the Ellie Fund. That was one of the reasons why I decided to come work here, because I wanted black women to see there is someone there that truly cares about the health and well-being and want to help, because a lot of our sisters don't like to take help. But I'm here to tell them that it's okay. You need the help. You may not need it right now, but as you go through your treatment, you will need it. I personally spoke with Jani over the phone, and we talked and we discussed what would be best, what the services that we provide would help her the best.
And I know that insurance costs can be prohibitive to so many folks. We had these new guidelines that came out, so it allowed women 40 and older to start beginning to get mammograms. I know I was notified by my insurance saying, hey, you're 40, you can get a mammogram now and we'll cover it. That's got to be huge. But I know that doctors have been advocating for a very long time to have the screening start at 40 and even earlier for folks who have, any sort of pre-existing factors.
Yeah, absolutely. I think some of the things to remember is that when we're talking about disparities, it's cancer, or even having the self-advocacy to go get your own cancer screening, you have to be in a pretty proactive and safe and good place. Yeah. And as one of our nurses at BMC says, she's like, cancer is not their biggest problem. Our patients come in and cancer is not what they have to worry about today. And you're like, wow. That really puts things in perspective. And so if you're living in hard times and someone's like, oh, you should get your mammogram, you're going to be like, forget about it. Yeah. I'm trying to get food on the table. I'm trying to get my kid safe and okay at school. And so I think what I like to think, we need to do more is just wrapping our arms around every part of people and really encouraging people that, we care and that, put your own oxygen mask on first before you can do other things. A lot of Black women have a lot of responsibilities. I think a lot of Black women are caregivers. They're like super women. They're working. They're providing for kids. They're providing for adults. They're everywhere. And those are the most vulnerable times. When you're stretched and then someone says, oh, yes, and go get this, you're like, forget about it.
Yeah.
And I'm here to say, no, don't forget about it. Yeah. Like, take care of yourself because you can't take care of others if you're not okay.
Sure.
Absolutely. Right? So
I totally agree. I think the other thing that we don't speak enough on are the resources within our institutions. For instance, I think about the role of patient navigators. These are individuals within the institutions that can help ease the burden of navigating what it means to have to walk that journey of having cancer. And one of the reasons why we don't ask for them is because we don't know about them, right? And again, these are individuals that have a pulse on all of the resources that are available, whether it be the Ellie Fund, whether it be getting assistance with transportation, whether it's helping out with daycare, food insecurity. All of that can come by the resources that are available within institutions. And what we need to do is better equip individuals about these kinds of resources that are available to them.
Is there more that these institutions can do in order to support women coming in and getting these screenings?
Absolutely. I mean, I think even prior to coming in, they need to be in the community talking about the importance thereof, right? And so I think people need to equip, there's a role of a community health worker that has been very much fashioned because they are very much familiar with community. They know that they tend to live in the community in which they're serving, and getting individuals aware of the importance of screening so that when they transition in, it's a transition that's really smooth. It's a transition where they're not necessarily, individuals are not made to have to set up their appointment, or because these are things that are done for them. So I think the more we can ease that process and make the patient become more familiar with what that looks like, the better it is for the individuals.
Yeah, and Nekia, I mean, when you're on the phone with folks like Jani, do you say, hey, here's the thing, like, you have coverage now, let's continue to get this work done for you so you can support your whole family?
Yes. I talk to them to see, well, they have choices. They can choose what they would like, but sometimes I can see what their treatment plan is like, and our funds are limited to a certain amount of time for grants. We have 3-month grants for curative, which is a stage 0 to 3, or a 6-month grant, which is a metastatic stage 4 patient. So we're limited to the time that we can provide. So we want to make sure we get it at the right time. So if they're going through several chemo treatments, I might suggest would you like transportation in the form of a gas gift card, or if you don't have transportation, we can provide Uber or Lyft gift cards for them. If I know that they're paying for childcare, we reimburse for partial childcare. So those are the conversations I have, because sometimes people don't know at the time what they need, and I'm there to guide them to what I feel would be best for them.
That's huge. You know, in the last minute we have, Jani, I'd love for you to talk to folks who may be watching that may be on the fence about getting screening, maybe not think it's part of, they have the space to do that. I'd love for you to talk to them about your journey and the importance of that.
I would definitely say that I understand the pride. Mm-hmm. I understand being overwhelmed and having a lot on your plate, whether it's caring for your children, for your parents, whether it's your work. But I have to say that making sure that we are at our healthiest for the people we love has to be a priority. Yeah. And as Black women, I feel that society has made us feel it's selfish putting ourselves first. It's selfish to make sure that we're all right first. Yeah. And that is a myth. Because if we're not all right, all the people we take care of will not be all right. And I have to say that Ellie Fund was the first who was instrumental in taking away my pride by offering me something, not making me feel like I had to ask for something.
Well, we're going to continue that conversation, but that is the end of our broadcast and the end of our show. Thank you so much for joining us. Now stay with us as we continue this conversation on our digital platforms, YouTube and Facebook. Hi, everybody. I'm Crystal Haynes, your host. We are on YouTube and Facebook with our post show, continuing our conversation on breast cancer among Black and brown women. And I know from our broadcast, I cut you off, Jani, but we were talking about the importance of going and getting these screenings, making the time to really safeguard your health for your whole family.
Yes. I'm not going to be as long-winded this time. I know it's very scary.
Yeah,
I was afraid. I'm still afraid. A lot of days, to be honest with you. The fear of cancer is something that we live with, I'm going to make the assumption, for the rest of our lives. So I understand the fear. But your desire to be there for the people you love and for yourself has to outweigh that fear. And that's the best advice I can give, is to be proactive about your quality of life so that those around you can enjoy you for as long as possible.
Absolutely. And Karen, I know you said that you wanted to mention a program that is also a good resource for women going through this stuff.
Absolutely. I think one of the areas that I think is so very important in this journey is really trying to demystify the disease of cancer, right? I remember back in the day where we didn't even call it cancer. It was the big C. You know, I remember my dad getting diagnosed with prostate cancer 30 years ago. And one of the projects that I've been working on with a coalition called the Faith-Based Cancer Disparities Network was to really look within congregations, look within our own churches, to identify cancer survivors who would be willing to share their testimony. And so this has been ongoing now for about 10 years, where we ask individuals who will respond to the question, what has the role of faith been in your cancer journey? And individuals self-identify and they come forward for a wonderful photo shoot. They answer that question, and then we have an unveiling party. And they get a chance to see their photos. But most importantly, the impact of that. What does it do? It allows for conversations to take place. Individuals see, wow, I went to school with her. Yeah. I didn't know she was a cancer survivor. Oh my gosh, she lives in my community. And so giving authority and giving permission to talk about the disease. And so that's one of the projects that I have, you know, it was supposed to be a one-time thing, right? It was supposed to be one time we did it. We were going to put the photos in the churches, and that happened. But 10 years later, I'm here to say that I don't have to go recruit. People are looking to be part of the Faces of Faith photo exhibit.
Yeah. And Dr. Ko, I imagine physicians have to then approach not just treating someone medically or physically and figuring that out, but also think about all of the social aspects that will need to be integrated in their care, connecting them to resources and things like that.
Yeah, well, one of the things I really love about my job is that I tell people I don't treat breast cancer. I treat the woman who has breast cancer. And what I love about my job is that every woman comes with her own beautiful set of needs and fears and strengths. And I think my job is to just try to do the best I can to meet that person, that human being, you know? And there's so many nuances to breast cancer care. There's so many different subtypes. There's so many different experiences that women get. And it's not the type of thing where you can say, oh, someone like, oh, I know someone who had breast cancer and they needed blah, 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 blah. I'm like, oh, remind yourself, I need to talk to Dr. Ko about this, because that may not have anything to do with the kind of breast cancer that I had. Does that make sense? And I'm a resource to try to tease through all of that information. But I think what's really important is that you know, patients feel like their doctors see them for who they are, not as just a disease or not just as a single, you know, person in a group of people, and to knock down all those stereotypes and to see them for the person they are. And I think that onus is on us. It's not on the patients who come to us. It's on the doctors and the nurses as what can we do? Should we have screening mammograms at 7 p.m.? Because that's when women can come.
Right, yeah.
Like, should we be getting innovative and creative about what we can do instead of asking patients to do more? That's kind of where I'm at. I'm really feeling that.
Yeah. And Nekia, as you engage with women going through this experience, you know, do you find that there are a lot of physicians like Dr. Ko, or are folks just sort of navigating a different kind of standard of care?
There's not enough doctors like Dr. Ko, and I'm not just saying that, but I'm hearing a lot of patients how it's brought to them when they find out. I remember when my mom first found out, she was driving. She called me hysterical. I've had patients tell me that, oh, buckle up, you're in for a ride. Like, how are you?
A doctor said that?
Yes, yes, yes. So I wish there were more doctors like Dr. Ko who knows that patients are humans. I understand that this is your practice and this is a treatment plan. Also think of the mental capacity of a patient, what a patient has to go through, the decisions they have to make. It's all so fast. It comes so fast, and you have to, one thing I tell a patient, I said, this is your journey, it's your decision, own whatever decision you make, because you can have 3 different decisions to make, and you don't know which one to take, but in your heart you know which one to take. And if that doesn't work out, there's always other options. So I wish there were more doctors like you.
Yeah, and it's always a challenge to be an advocate for yourself while you're going through something like that.
Right. Because you want to trust the doctors and know that they're giving you the right information. But if doctors make those type of comments, how can you trust them? Or give me more than just the one option. Reconstructive surgery. I remember going into the office and I was sitting in a room with a video showing me what an implant would look like. That's not even what I wanted, but I wasn't given that choice. So guess what? I switched doctors and I went to who would listen to me and what I wanted as far as treatment plans.
Wow. Yeah,
I would
Jani,
love to definitely. I'm in the process of getting my reconstructive surgery, in January. It has been daunting.
Yeah.
I had some other health issues that kind of conflated the type of reconstructive surgery I could have, but I saw initially one doctor, and it was such a horrible experience that I left crying. And even though I've cried a lot through this, I'm not really a crier in that way, but it was just so deflating because, for me at least, in my journey, the silver lining was getting my breast back.
Yeah.
You know, that was the goal. That was like the mountain that I could get to. When I went into my initial meeting with this doctor, it was kind of like, well, sorry, if you don't want to do an implant, then you can't get a breast. And I was so defeated. Yeah. It was Halloween. I had to go out trick-or-treating with my kids and but luckily I found another doctor. We talked through it. We figured out some things, and luckily I'll be able to get my surgery in January. But I wanted to say that for families or caregivers or people who are trying to support someone going through breast cancer, this has been a question that I've gotten from my own family and friends. What can we do to support? I think the biggest thing that you have to understand is that our journey doesn't end.
Yeah.
And although we may look good, we may look healthy, we may be moving around like normal, we may be out of active therapy, we are very much still fighting. Still fighting cancer, because cancer is such a mental beast. It's such a mental disease on top of physical. And I just hope people can understand that the support we need is just that, support. Sometimes it's just sitting and not saying anything. Sometimes it's showing up at a infusion appointment without asking. And I know some people may be like, oh, they didn't ask. But I know for me, I didn't want anyone to see that. I didn't want my family to take on that burden. I didn't want them to see me suffering. So I never had anyone come with me when I got infusions. Never. And you may say that, but I would have loved, of course, to have someone there. So sometimes you just have to, you know, stop by, cook something. Food, eating is such a thing, especially on the pills. Drive your kids to practice.
Yeah.
Those are ways you can support. Calling in the morning, how you feeling this morning? You know, I don't know what your aftercare was, but for me, Verzenio, I'm on a chemo non-active. It's ugly in the morning.
Yeah.
You know, so little things. Just keep us in your mind, even if we look like we're okay.
Yeah.
I had a question. Is that okay? Yeah. I was wondering what the three of you would think of a patient that I saw recently with triple-negative breast cancer. I got her scan. It's a stage 3C, and I had set her up for chemotherapy. You know what I'm talking about. And she came in and said, my family and I decided that we're not getting treated, and we're going to use alternative therapies. I've had this happen to me many times in my career, and every one of those patients died. And I saw this patient, and I said, you're killing me here. And I came on strong. But then I hear your voice, and what you tell patients is like, if you don't feel good with your doctor, like you do you. You pick your choices, and there is a side of me that's like, okay, you know, if she wants to just take alternative therapy, you know, that's her journey. I can't force her into taking the chemotherapy, even though I've seen the story. I've seen it, and I've seen people really suffer after. So what advice do you guys have?
Yeah.
So I can speak, you know, from family history. I remember, like, my grandmother would say, no, don't let them cut you, because then it'll get worse. Right? So we have, like, my family is from the South, and there's these things, back then, they didn't have doctors. They diagnosed themselves. So I think that's still around. We still have those old school, really into religion, give it up to God, which by all means, but you have, if you're already afraid, and then you have family members like, no, such and such, that happened to them, and now they're not here, you can't. So you have those people who have that strong hold on you, and you're already afraid. So that's why you choose not to seek treatment.
Yeah. But I think it's a fear of medicine. I know for me, I know that I said that I was aggressive and I decided quickly, but I got inundated with, my friend had metastatic breast cancer, and they juiced and they ate ginger root for 5 months, and they were cured. And then you have other people who have had it, and they basically say, you know, they're pumping you full of poison. Deadly poison. Do you really want poison? So I think what it is one combating the fear of medicine, of modern day medicine. And what happens, and we're in this conundrum of all these vaccines too. So people already are like, oh no, they're just trying to put all of this in my body. So I think the best thing you can do is just keep giving this patient the information, the statistics of, I know this is scary, but I want you to see what's happening. And they have to go home and weigh that. And that family influence is heavy. Luckily, in my family, it wasn't anti-medicine. It was more, are you sure so quickly you want to start this? You don't want, because I told you I got diagnosed in February and I started chemo in March.
Yeah.
That was more of it with me. You don't want to wait a little bit. You don't want to think about it. But I think if you show this patient tangible evidence of this is what has happened when people have decided to go holistic. Yeah. And I'm not saying you can't use some holistic, because I've used holistic, I've used
with the medicine.
Along with, I juiced every day during infusion. I did 3 juices every morning, and it did help with I worked out, but I did it along with chemotherapy.
Yeah.
I'd like to say that I also think that we have to respect individual choice, right? And I appreciate, Jani, your comment, because I think we have to understand everybody presents differently. Yeah. And as we talk about the treatment of an individual holistically, we have to understand that aspect. Yeah. And at the same time, we have to bring forth, let me tell you what the data shows. Yeah. Let me show you what the research shows. Yeah. And hence why it is so important to infuse communities of color with information on an ongoing basis, so that they recognize and understand that this is not about, we're not here to harm you. Yeah. You know, it goes back to your comment, Dr. Ko, about trust. Yeah. And building enough trust for you to be able to say to this individual, I am listening and I hear what you're saying, but I also want you to listen to me. Yeah. Yeah.
You know, I've done this a long time, and I just, when someone's a stage 3C, triple negative, and they are not going to get chemotherapy, I mean, I can't sleep at night. Yeah. I can't sleep at night. And I get so stressed about it. And then part of me, I think part of it for me is I also have to let go a little. And if I'm really being self-reflective, because I can't force someone to take it, because then again, she may be stage 4 right now. Yeah. And then I've given her the chemo and she took it, and then she's like, well, see? And I did what you said. And I'm like, oh, I can't, you know, there's no win. So it's a relationship, and it's trust, and it's doing all that.
Knowing that you have her best interest. Like I said, I had never heard of 3C before I was diagnosed.
And I think also connecting people to what you do, to
other
your
survivors,
advocacies, other survivors. I think that that's key. But we're going to have to leave our conversation there. We could talk all day. Continue this conversation in your households. You know, we will have resources available to you as well. So I'm Crystal Haynes. I want to thank you so much for being with us.
Thank you, Crystal.